Okay. Okay, good evening, guys. This is me again, Betty, and I have here with me my good friend, Dr. Krishna. Dr. Krishna is, of course, the medical director of TNB, and now Dr. Krishna has. How long have you been in the corporate world, Krishna?
It's going to be my fifth year.
Fifth year. Oh, fifth year. Okay, and the problem is now we have a lot of doctors who are in actually either contractual basis with the MOH, and then so more and more people are actually losing interest in clinical work, not because of any choice, but one is because they find it very difficult to further their studies, considering that this contract makes it very dicey for them, and it's so much uncertainty. So what we want to know is, okay, we want to give them an option of how it's like in the corporate world. Okay. Now, of course, you were once with, like all of us, right? You were in a clinical job before, right? So when do you graduate?
Okay, very good evening, Dr. Betty. Thank you for inviting, and very good evening to all my doctor friends for joining today. You guys are doing really a fantastic job with the current pandemic situation, fighting with the COVID. Really salute for that. To answer Dr. Betty, yes, I graduated 2005 from Melaka Manipal Medical College. That's how I graduated. Yes, I've started the career like any one of you. Go to the housemanship, completed housemanship, then the compulsory service 4 years. And then also, I was very interested in the surgical field. So, sorry?
Yeah, you were interested. You pursue this try to pursue this surgical career?
I attempted actually. I attempted MRCS part 1 and got through. Then after that, I posted to district hospital where my interest changed to medical. So
your interest changed to medical as in being a physician?
Yes, then I attempted to MRCP twice, and then I didn't get through part 1.
Okay.
Then I was in an emergency for such a long time, even in a KKM or in the private. I was always in the emergency. Then I got bored. I was thinking there's no growth career for a medical officer when you move to private. You see, it's just a life is static. Once you come out from government, your career path becoming the next step, being a specialist is not there. There's no light under the tunnel when you come to the private. Yes, the money is okay, the salary, but there was something lacking that you can't progress. The career path was not promising in private for medical officer concerned.
Oh, yes, that's right.
Yeah.
So you went on to do the masters, right? If I remember correctly.
Yeah.
So you did a master's in medicine or master's in surgery?
No, not in the medical field. I did masters in the business administration.
Oh, you did masters? No, you didn't do masters in surgery or?
I quit my master's first year program, then I quit.
Okay, so you actually joined the masters and you quit. So you didn't finish.
Didn't finish, yes.
Okay, so again, because you're the second person that we have actually interviewed on switching careers. Okay, and for us, okay, in the medical field, when you actually did not pursue it completely, a lot of people might, especially your parents, okay, might see it as a failure. Okay, and of course, the first one we interviewed was actually Dr. Rama. He actually is a lawyer now. He didn't even finish his housemanship. and he was a JPA scholar. And now here you have you tried to pursue your master's in surgery. Okay, I want to ask you, why from surgery, then when you went to district, you decided that you like medicine, and then you went to do your master's in surgery?
Yeah, that's a crazy part of it. When I just want to be a specialist, not setting up direction, limiting myself to either surgery or medical when it comes to district. So anything that any field that I want to go venture into, become a specialist. So I had a crazy idea that I thought in the clinic kesihatan with my FMS influence, I thought taking up MRCP will be the better choice, becoming a physician faster rather than wasting time
Yes,
waiting for
yes,
the
yes, yes.
in the surgical field. That was the. But when I applied for the master program, I got surgery.
Oh, I see.
So
Okay.
so that's how I
So,
ended up with the master program.
and then after which you didn't, how many years did you spend in the master's?
Okay, well, something came up and life was a bit difficult for me. And then first year, I quit in first year. I got the UM as a master program, and I quit the first year.
And
And
after
then I
which,
went to the private.
okay. So in the
I
private, you
joined the
went as a
private.
medical officer.
Yes,
In the private,
first my career started with Aruna. Yeah,
you started with
sorry.
Aruna Murray. So now which is became
Yeah,
Manipal, and now I
Many,
think Ramsey has acquired Manipal. Okay, so
yeah,
you started as a
that's it.
medical officer, and then you went on to become the head of medical officer, right? So
Yes.
how did you then get this job, TNB?
Okay, that's $1 million question. I just I have always has a passion of doing something bigger for. I'm always interested in the health economics of the in the healthcare industry. I always wanted to know more about how this the finance works behind the healthcare industry, and also I'm when I was the chief medical officer, I always interested to do policies for the hospital. I'm always involved in the committee, make myself available in the committee for
Okay,
developing some policies. So that's add to my CV when I applied to many
I
GLC.
see.
Yeah, then one of I applied Petronas. I applied Petronas,
You
Eco
applied for
Solution.
other companies also?
Yeah, yeah.
Which company do you apply for?
I applied to Petronas, applied Eco Solution, and a few companies. So
Huh?
that actually my idea was going to the management. When I was in a private, as a chief medical officer, already involved in the management most of the time. So I thought of and applied some insurance company as well, AIA, Great Eastern, to be a medical advisory.
So
Then,
this change of direction that you had in mind, okay,
mhm.
first of course you entertain the fact that you may want a change in direction in your career. Is
Yeah.
that and when did this happen? After you came out as a medical officer in private, is that when you started having a change in your thoughts that you may want to go into corporate?
Okay, the turning point of my my career was I would always tell my ex CEO of Manipal Hospital last time, where he's a Indian expatriate, and one of he's leaving Malaysia for good and is joining the career in back in India. The day before he leave the country, that both of us went for a drink, and then he started advising me how do you see yourself in next 5 years. That makes me really an eye-opening for me. He drew some
Or just
graph,
that statement,
and
huh?
then I was fascinated. Yeah,
Okay. For all
yeah, I
those
was just
out there,
fascinated.
okay, for all those out there that now may have an idea that they want to go into corporate, what are the things that they can actually look at? What are the jobs prospect that you can actually look at in the corporate?
Okay, I'm not discouraging any doctors. I'm also telling there is
The
an
truth.
opportunity to come this side of the game and look into the medical field on the higher perspective. Yes, you as a clinician, you also can manage, see doctors and everything. A lot of doctors are reluctant to take that path, no, I'm a doctor. I always want to see the patient kind of thing. But
Yes.
this part of the management side, you will sit more higher and look down on the field, the healthcare field more in a wide angle. You will get a different
Like a
experience
drone,
and
like a drone.
um,
Like you have a drone and you are above everyone and you see the
exactly.
whole picture, right? Yes, I get what you mean,
Yes, yes.
because I had dinner with you, and then remember you told me that Betty, you should actually look into preventive cardiovascular healthcare, and that really changed me also, that statement in itself. I actually then brought me to another level of my thinking and how I actually want to pursue, okay, a different angle in medicine. Now, what I'm asking now is for all those doctors out there who now have to think of whether they want to stay in clinical or whether they want to come out. What kind of jobs can they apply to? What kind of companies actually employ doctors?
Okay. Yes. If you notice, many medical friends, being a nurse or a medical assistant or some doctors, I pulled into corporate life to show them. Then now they are really enjoying their life here. The enjoy is not to say enjoy. There is no stress. There is a stress, different stress in the corporate level as well. Everywhere there is a stress. As a clinician,
Yes.
you have a stress seeing the patient and treating, then the outcome of it, and also in the corporate side also you have this different kind of stress, but is I would say it's a manageable stress. What I'm trying to explain is this part of the healthcare industry is a crucial. If you know, it's a very essential. We know, but it's a crucial. The COVID pandemic already confirms that many industry that healthcare is very absolutely necessary. And major big industries, they have a many employees. Their medical benefit need to be managed. The medical benefit is in the industry is a very highly very costly when they're managing the medical benefit for their employees. So that's where the medical doctors needed to be advisory, as advisory and as a policymaker in terms of medical benefit concern. Now, a lot of company looking for a doctor who can advise them in the medical benefit wise for their employee, like all the insurance, uh, all the GLCs, many companies, pharmaceutical companies. I always wanted to see a doctor to be a CEO of a hospital uh, uh, in the future, because many times I hear the doctors cannot be the CEO, they don't have the financial knowledge. I can prove that wrong. Doctors, when they learn medical, they also learn some finance, but only thing they don't apply in the clinical settings. When it comes to the corporate, and when they learn a little bit of health economics, yes, it will take some experience. You will gain along the way when in a corporate. But
Oh,
once you know this finance and the health economics, you can really be one of the top position in the any organization as a medical doctor.
oh, yes, there are not many hospital managers or even CEOs that were doctors or before, but I think next month I'm going to interview Chong Su-Lin. Do you know Chong Su-Lin? Chong Su-Lin was actually the CEO of Sunway and the ex-CEO of Sunway and Beacon, and she was also a medical doctor, a very smart, intelligent lady. So coming
Choi
back
is
to
no more Sunway. Choi is no more CEO of Sunway. Oh, I think he's left it.
oh, Choi. Choi was a doctor? No, Choi
No,
is
he
not.
wasn't a doctor, but he was
Yeah,
a
yeah.
CEO of Sunway when I'm.
Yeah, I think he has changed portfolio. I'm not sure. I've not met him personally. But coming back to this TNB, TNB actually is a very, okay, TNB patients, for all those who don't know, actually they're veteran patients, veterans, right? They actually covered medical even after retirement. Is that right?
Yes, that's right. We do cover retirees, which is we call it in a funny language, womb to doom coverage. I mean, from the day they born or until they
Really? Oh
die,
my
we cover
God,
them.
that's not a very nice term, but okay. So you covered even their spouse.
Yeah, that's right.
Okay, that makes a lot of hospitals and doctors very keen to be associated with TNB patients because of this coverage. And I think another point is that this coverage is unlimited, if I'm not wrong.
Well, that's my role to, yes, it is unlimited. My role is to limit because
The
when
role
you
is
say
to limit.
unlimited, the cost is, yeah,
Okay,
yeah.
so in your work, right, you actually have to manage this part where there is to look out for any abuse of your funds. Would you say that?
Okay, as everyone knows, that's medical inflation. The healthcare industry is 12 to 13% every year. So, well, TPHAs, sorry, the thunderstorm, my place, heavy rain. Uh, any roles in the TPHA or the insurance company trying to bring down within the industrial average, the escalation, the medical cost escalation. So it's a duty of the medical advisory with the entire team to keep the medical cost within the medical, uh, the healthcare industry, the cost. You know, is 13% is extremely high when you're talking about the millions of money. When you talking about 13% is very huge money. So is the duty and the role or responsibility of the medical advisory to keep within the industrial average.
Okay, so
Well, you can
how
keep
do
it
you
below
how
is
do you how do you um reduce the expenditure of the healthcare, I mean expenses in TNB then?
okay. We have two part of it. When you're in the management, then you will learn all these things.
Mm-hmm.
Two parts in. You're going to observe the doctors not going to misuse the benefits. You're going to observe on the medical unethical practices and malpractices, and a hospital overcharging some bills. So you'll have a very good data analytic team with you to give you a sort of information all the time. Keep on giving you the information. No, this particular item is getting escalated, so you need to go attention. So we will come to the hospital and negotiate on certain procedures. And if the doctors are overcharging, we have the schedule to fall back on, kind of things. The another part is that I advised you earlier when we met is the preventive part. The medical cost only can be reduced when you touch the preventive part of it. You only want to spend money on the treatment. No, there is no savings. So the moment we touch the preventive, we really see a lot of results. And this is only applicable. You see the fruitful result when you're in a management side, in this side of the game.
Okay, from your clinical days to now as a director of TNB, a medical director of TNB, okay, what kind of um what kind of further development in your studies did you do? Did you do let's say an MBA? Do you further any studies?
Well, there is a couple of the discipline can take when you're in the management. Of course, all is the management courses. MBA is a must for you. And another one I will recommend anyone has intention to intend to switch their career from the clinical to non-clinical to do master in healthcare law and medical ethics. This is another field where the doctors are needed with this subspecialty. It's a 2 years course. You can do part-time. This is master course where you will be a very authorized person to give advice in terms of healthcare regulations to any industries or insurance companies or any TPHs. In Malaysia, the TPHs are growing. Many industry would like to offer medical benefit for their employee, but they also very concerned on the cost. So there is a lot of role and responsibility for a doctor outside of the hospital, actually.
And traditionally, it is medical director's role in TNB. Was it held by a doctor before?
Yes, there was always a doctor because this is a medical term. Sorry. It's a medical field that they need a doctor always. Before me, there was a Dr. Rahman was there in TNB advising on the, he was been a medical advisory. Now I'm replacing him. And
Okay.
after me will be another doctor. Yeah.
And how many people do you have in your team?
Okay, TNB is different because we venture into healthcare as a third-party administrative, our own. TNB formed our own TPHA. It's called TNB Healthcare. So we
Okay.
manage about 1,300 medical providers and over the 200,000 of members and kind of thing. So we are TPHA ourselves, our own TPHA.
Okay, so the next question that I'm leading to is, now I think by end of this year, we are probably going to have a fair number of doctors who are finishing the contract and MOH will not renew. And then next year, by June next year, probably about 2,000 to 3,000 will not have a job. Can we then plead to TNB, okay, that any future doctors that you take, any future people that you take into your department to be a doctor?
Okay, for your information, Dr. Betty and the friends around there, TNB just recruited additional 3 doctors because we have also dispensaries to be managed throughout Malaysia. I just recruited 3 doctors to manage the clinics. But we are new kids on the block. We are just a new TPHA. We have a lot of things to be improved. To be, yes, we are in par with the other TPHA. We want to be one of the best TPHA in Asia. Actually, that's our aim. Vision, and vision. But there's a lot of works need to be done. Yes, if everything goes well, is the TNB healthcare prosperous, then why not?
Okay, what is TPHA? Can you just explain briefly what is TPHA to us?
Okay, TPHA is a third-party health administrative. That means you have a hospital, you have a industry willing to pay for their medical bills for their employees. So you need someone in between to process all the bills and negotiate with the hospital on the high bills, monitor the doctors or not from not being highly charged bills and everything. So that's called PM Care was the TPHA.
Okay.
And there is some
Medicare?
Medilink, Complement, Medicare, Medilink, Complement. There's I think about 15 I know. I know a lot of doctors are inside there. When I meet MMA, we have a discussion with MMA on the fee schedule. I met a lot of Great Eastern, a lot of doctors are in the insurance company. We meet from the AIA. They're all TPHs, so we meet together, we share our knowledge and our ideas, and that's how we
so
grow.
previously, TNB would have engaged a TPHA to manage for you, but now you have actually a TP. You have set up your own TPHA.
Yes, that's right.
And you also have started your own clinics, if I'm not wrong.
Yeah.
Dispensary,
We
you call it.
our dispensary also are transforming into the private clinic. It's not to serve the public. We are not being competitors to the other clinics. We only serve our members.
I see. So now, would you come to a point where you would only allow your TNB employees to seek treatment in your own clinic then?
We encourage, but we won't force, because this clinic is, some clinics dispensaries are inside the station, which is the public. Even though our members, they are not allowed to go inside the station to get the treatment from dispensary because of the safety reason.
Oh, I
So
see, I
in that,
see. So they are actually stationed, the clinic is in the work area.
only one is outside. There is a one, three at the moment is outside our power plants. That going to be transformed into clinic there, so that we can offer more service and give the more job opportunity to the doctors.
Oh, I hope so too, because I really am very worried about the doctors. I think this is just a chit chat. Is there any questions at all? If you have any questions, please ask us. And where do you see yourself in the future? Or what do you
Okay.
intend to bring TNB medical, department at the moment to be in the future?
Okay. Yes, I got a lot of crazy ideas, but the
Yes.
one at the moment is we are want to be one of the top 3 TPHA in Malaysia first.
Oh,
And
okay.
then we would like to venture into preventive measures. Yes, we are thinking of a lot of ideas in our mind. Let's see, one at a time we take that.
Yes,
Our
especially
system,
now with the pandemic, right?
the challenges we have is the IT system. We don't have, the current billing is still manually uploaded in the system. It's not like an online transaction. That's why you see your final guarantee letter is very delayed. So we are looking into everything online, like banking system. Then we can look into the other opportunities.
Okay. Any questions at all, please? Anyone? I'm so happy to see you. It's been some time.
Yeah.
When we went to meet up, the second MCO happened, and then now the third MCO happened. So I do hope that your vision will grow and then it will come true. But looks like there's no question, because actually I told Krishna no need to do any slides. We will just chit chat. Okay, if there's anything that we need to discuss further, we can always invite him back. So I've been having this webinar every week so far, and then we started this switching career kind of chit chat, and then you are the second session. Eventually we'll have more, and I've managed to get the comedian Dr. Jason Leong to come and chit chat with us also later, I think in August. So, but the next 2 months it will be mainly CPD points webinars. So I think if there's no question, we will end here. I will message you, and yeah, we'll see how. And it's very, very nice to see you, and I would like to thank you for making time to have this chit chat. And do join us on our medical forum. We have a medical forum, which is on Telegram. And sometimes we discuss cases, and I will send you the link. Yeah.
Okay.
Okay, thank you.
And
Bye, guys. See you then.
thank you. Stay safe, everyone.
Bye-bye. Hey, bye, Krishna.